My question is for the Minister for Children. Does she stand by her statement, quote, "We have refocused the children's system on what matters, the safety and well-being of children, whether in the community or residences, and the results are clear," end quote. If so, which results is she referring to?
Mr Speaker.
The Honourable Chhour.
Thank you, Mr Speaker. Yes, in the context in which it was made, which was the achievement of the first ever reduction of harm in youth justice and care and protection residences, a 14% decrease since 2024, which is a reduction of 33 findings of harm. Other results from the Safety of Children in Care report include a decrease in physical harm findings from the previous year and a reduction in harm by staff. However, at the same time, I also stand by a statement I made in the House during question time on the 23rd of October that, quote, "I acknowledge that the latest Safety of Children and Care report shows that in 12 months to 31st of March 2025, there was an increase of 23 children and young people who had a finding of harm compared to the previous year."
Is it correct that there has been an increase in recorded findings of harm for children in state care?
Mr Speaker, I believe I just answered that, where I said there was a finding of there was an increase of 23 children and young people who had a finding of harm compared to the previous year.
Supplementary. What does she say to Te Aotearoa Tamariki Chief Executive Aaron Jones and Children's Commissioner Dr Claire Ahmad, who warned, quote, "Overall, the number of children in state care being abused or neglected has increased and this is unacceptable," end quote. And, quote, "We must pay attention to the fact that 10% of all children in state care were abused or neglected over the last 12 months, end quote."
What I would say, Mr Speaker, is yes, definitely it's unacceptable. No child should be hurt or harmed in this country. And if you are taking care of a vulnerable young child in our care, don't hurt them, don't harm them, and take responsibility for your actions. Because at the end of the day, if people that care for our young people don't hurt or harm them, we wouldn't be in this position to have oranga tamariki.
Supplementary. What does she say to ngā morehu, the survivors of state abuse, as we come to the anniversary of their apology, when reports tell us that the cycle of abuse they endured continues for tamariki in state care today?
Mr Speaker, what I would say is that the highest risk of harm is return to home care. This is where families and whānau are given a second chance to look after young people who have been removed from their home in the first place. We put support around those whānau and family, but ultimately at the end of the day, the person responsible for the harm is the people that are caring for those children.
Supplementary. Does she support implementing all recommendations of the Royal Commission of Inquiry into Abuse in State Care? If not, why not?
Sorry, Mr Speaker, can you just repeat that question?
Of course. Does she support implementing all recommendations of the Royal Commission of Inquiry into Abuse in State Care? If not, why not?
Mr Speaker, there is currently a work program in place around the report of abuse in state care and faith-based care. What I would say to you is that this is a large work program which the government is committed to working through to make sure that across the board that young people are safe in the homes that they live in, and that is my priority.